Yeah, I think since immunotherapy-based treatment has become the frontline standard for recurrent metastatic head and neck cancer, there's been a lot of unmet need in understanding what are the real-world outcomes in second line, third line, after recurrent metastatic head and neck cancer patients progress on frontline immunotherapy and chemotherapy. And what I think was interesting is that the overall survival for these patients in the real-world setting is quite poor. The median survival was only around 6 months for patients that had HPV-unrelated head and neck cancer, only approximately 9 months for patients who had HPV-associated disease. As expected, HPV-unrelated head and neck cancer patients did have worse survival even after they progress on PD-1 and platinum-based chemotherapy in the recurrent metastatic setting as compared with HPV-associated disease. And as these are quite sobering results, I think it's important that we see this and discuss this because there's been been some evidence that many of the second, third line treatments do work better in the post-immunotherapy era as compared with in the historical data from before there was immunotherapy given, but nonetheless, we still see quite sobering survival results. And so there remains a huge unmet need in this population for improved therapies. And I think we saw that illustrated with some of the data related to amivantamab this meeting.